Susan Bishop and her late husband Ray first visited Bali in 1989. In 2010, Sue and Ray left Australia and moved to an area close to Lavina in Bali. After a couple of snorkeling weekends in Ahmed, another more daring dream took hold, a clinic that would provide consistent healthcare in an area where people had no access without travelling far from their villages. The clinic in East Bali is located in arid Karangasem Regency, a rain shadow area and the poorest area on the island. Between 300,000 to 400,000 people live on the slopes of an active volcano, with a lack of passable roads, access to water, basic education, and basic medical care. Susan used her fundraising skills to kickstart Yayasan Bali Sehat. She used pop-up clinics and staffed them with doctors, nurses, and pharmacists. Her small clinic used 266 volunteers to treat 1,156 patients with dental needs, eye problems, women's health, and other medical issues.
We came to Bali starting in about 1990 on holidays, and we would come and we'd enjoy the tourist side of Bali, and then we started to expand into the real Bali, or into the mountains. And I like to do hiking, or I did then, and used to hike up in the mountains, and we started to see some of these extremely poor people. We got involved with some people. We met some Americans who were doing a water project, and they said to us, we're doing this water project, you could help. And I said, well, how can we help? And he said, there's no health care, we need help. And I said, well, can we start in a small way? And he said, yes, why don't you donate a wheelchair? So we got a wheelchair for a young girl who was 17, way up in the mountains. And then we left Bali and came away, and then we came back in 6 months, and we said, oh, let's go and see the girl and see how she's making out with the wheelchair. Well, the house was built on a very...
Susan ran her own fundraising ventures across the island until 2014, when benefactors funded a larger permanent clinic, Clinic Pratama Bali Sehat, with capacity for 23 patients. The clinic opened in June 2021. The clinic is staffed with qualified local Balinese and set up for the future with a board comprising both Indonesians and Australians.